drug of choice for typical absence seizures in children? Speak, prosody rate 100%, ethosuximide. Remember, ethosuximide ends classroom daydreams. Broad-spectrum AED that blocks Na and T-type calcium channels and raises GABA levels? Speak, valproate. Valproate. Remember, valproate very versatile voltage blocker. First-line drug for focal partial seizures that strongly induces CYP enzymes. Carbamazepine. Remember, carbamazepine cranks liver gears. Antiepileptic with highest risk of neural tube defects in pregnancy. Speak, valproate. Valproate. Remember, valproate vaults over fetal safety. AED associated with Stevens-Johnson syndrome in HLA-B 1502 positive Asians. Speak, prosody rates 100%. Remember, lamotrigine lights the skin on fire. Preferred benzodiazepine for initial control of status epilepticus IV. Speak, prosody rate 100%, lorazepam. Remember, lorazepam locks status fast. Irreversible concentric visual field loss is characteristic toxicity of vigabatrin. Remember, vigabatrin vanishes vision forever. Levetiracetam binds to which synaptic vesicle protein? Speak, prosody rate 100%, SV2A. Remember, levetiracetam loves SV2A latch. Speak, prosody rate 100%, renally excreted AED with minimal drug interactions. Levetiracetam. Remember, levetiracetam leaves liver alone. Classic AED causing gingival overgrowth and hirsutism with chronic use. Phenytoin. Remember, phenytoin fills gums with fuzz. Maximum IV push rate for phenytoin in adults, milligrams per minute to avoid arrhythmia. 50. Remember, phenytoin 50 max or heart flips. Speak, prosody rate 100%, drug of choice for juvenile myoclonic epilepsy, JME. Speak, valproate protein from German. Remember, valproate vapors myoclonic jerks. AED producing weight loss, cognitive dulling, and kidney stones. Topiramate. Remember, topiramate trims weight but tanks wits. Gabapentin mechanism of action. Speak, prosody rate 100%, blocks presynaptic alpha-2 delta CA channels. Speak. Remember, gabapentin grabs calcium doors shut. First-line therapy for infantile spasms, West syndrome, not due to TSC? Speak, prosody rate 100%, ACTH or oral prednisolone. Say the prosody, rate of 0. Dislic sale, SLAN. Remember, ACTH attacks baby spasms. AED contraindicated in recurrent kidney stones, urolithiasis. Topiramate. Remember, topiramate turns P to gravel. Phenobarbital enhances GABA by prolonging X of chlorine channel opening. Anomalous duration. Remember, barbiturate keeps gate open longer. Phenytoin shows saturable zero-order kinetics once enzymes approach blank. Speak, prosody rate 100%, capacity. Remember, phenytoin fills up metabolic bucket. Hyponatremia due to SIADH is common with which sodium channel AED? Carbamazepine. Remember, carbamazepine sucks salt slyly. AED that enhances slow inactivation of voltage-gated sodium channels, useful add-on for focal seizures. Lacosamide. Remember, lacosamide lulls sodium slowly. Oral AED that is a non-competitive AMPA receptor antagonist for refractory focal seizures. Speak, perampanel. Remember, perampanel pulse AMPA plug. Speak, IED reserved for Lennox-Gastaut due to risk of aplastic anemia and hepatotoxicity. Speak, felbamate, prosody. Remember, felbamate fixes fits but fails marrow. Valproate doubles lamotrigine levels by inhibiting its metabolism. Glucuronidation. Remember, valproate glues lamotrigine in blood. Prodrug of carbamazepine with fewer drug interactions. It's a Speak 3 sarcose. Remember, oxcarbazepine is carbamazepine on a diet. Sulfonamide AED that can trigger rash and metabolic acidosis by carbonic anhydrase inhibition. Speak, rate 100%. Remember, zonisamide zaps bicarbonate. Pregabalin is licensed for focal seizures and especially for colon pain. Neuropathic. Remember, pregabalin pampers nerve pain. In the previous use your message, high-affinity SV2A binder, similar to levetiracetam but with fewer mood effects. Speak, prosody rate 100, brivaracetam. Remember, brivaracetam is lev in a better mood. Benzodiazepine commonly used as add-on for Lennox-Gastaut syndrome. Clobazam. Remember, clobazam calms Lennox chaos. Speak, oral cannabis-derived product approved for Dravet and Lennox-Gastaut. Cannabidiol. Remember, cannabidiol cools Dravet storms. Stiripentol boosts GABA and inhibits CYPs, always given with clobazam for blank syndrome. Dravet. Remember, stiripentol stirs Dravet defense. Speak, rectal gel benzodiazepine for seizure clusters at home. Speak. Diazepam. Remember, diazepam dives in through rectal route. Speak, nasal spray midazolam brand approved for acute repetitive seizures. Speak. Speak, prosody rate 200, nasalam. Remember, midazolam mist stops mini storms. AED with lowest teratogenic potential and preferred in pregnancy for generalized seizures. Speak, prosody rate 100%, lamotrigine. Remember, lamotrigine loved by little fetuses. Sodium channel blockers generally worsen absence and seizures. Speak, myoclonic. Remember, blockers make myoclonus mad. Ethosuximide common adverse effect causing school absenteeism. Speak, prosody rate 100%. Gastroabdominal pain. Speak. Remember, ethosuximide aches tummy SV. Children under 2 years on valproate are at higher risk of fatal horns. Speak, prosody, hepatotoxicity. Remember, tiny livers hate valproate heat. Hyperammonemia from valproate overdose is treated with IV. Speak. A prosody rate 100%. Remember, carnitine clears cloudy brain ammonia. Fosphenytoin is dosed in milligrams of equivalents p.e. Phenytoin. Remember, fosphenytoin counts as phenytoin points. Loading dose of fosphenytoin for status epilepticus is (PE kilogram. 20. Remember, 20 PE per kilo for rapid stop. Lacosamide can prolong which ECG interval? Speak. Prosody rate 100%. PR interval. Remember, lacosamide lengthens PR pause. Stevens-Johnson risk with carbamazepine is screened by which HLA allele in Han Chinese? HLA B*1502. Remember, check 1502 or face fiery rash. Gabapentin elimination half-life rises markedly in end-stage disease. Speak. Prosody rate 100%. Renal. Remember, bad kidneys grab gabapentin longer. AEDs that are enzyme inducers can reduce effectiveness of pills. Speak. Prosody rate 100%. Oral contraceptive. Remember, enzyme inducers invite baby boom. Topiramate carbonic anhydrase inhibition can produce non-anion gap metabolic. Speak. Prosody rate 100%. Acidosis. Remember, topiramate tips pH acidic. Valproate inhibits degradation of which antiretroviral, raising its levels? Lamotrigine. Remember, valproate lifts lamotrigine like trampoline. Speak. Prosody rate 100%. AED uniquely effective against both absence and generalized tonic-clonic seizures. I see. Speak. Prosody rate 100%. Remember, valproate versatile, 2-in-1 hero. AED that blocks NMDA receptor glycine site, used adjunct for partial seizures. Speak. Felbamate. Felbamate. Remember, felbamate fences NMDA gate. Oxcarbazepine active metabolite is called? Speak. Prosody rate 100%. 10-hydroxycarbazepine, MHD. Remember, Oxcarb turns into MHD magic hammer. AED that may precipitate aggressive behavior and irritability despite low interactions? Speak. Terrais, levetiracetam. Remember, levetiracetam sometimes lifts temper levels. Ethosuximide is metabolized mainly by hepatic CYP. Speak. 3A4. Speak. Remember, ethosuximide exits via CYP 3A4. Rufinamide shortens QT rather than prolongs, contraindicated in familial syndrome. Speak. Short QT. Remember, rufinamide risky in already short QT hearts. Valproate increases serum levels of phenobarbital by inhibiting enzymes. Speak. Prosody rate 100%. CYP2C9. Remember, valproate vetoes barb clearance. AED that can cause pancreatitis and hair loss along with weight gain? Valproate. Remember, valproate plucks hair and pounds pancreas. Phenytoin severe toxicity manifests early with horizontal nystagmus. Speak. Gaze on closer. Remember, eyes wiggle sideways, sign of too much phenytoin. Clonazepam is effective for absence, but limited by rapid development of. Speak, tolerance, tolerance. Remember, clonazepam comfort fades fast. Zonisamide can reduce effectiveness of which dietary vitamin by binding? Speak, folate. Remember, zonisamide zaps folate fuel. Brivaracetam, unlike levetiracetam, does not significantly raise symptoms. Irritability. Remember, brivaracetam brings calmer mood. AED that may cause word-finding difficulty, called cognitive fog? Topiramate. Remember, topiramate tongue trips on words. Pregabalin scheduling, listed as controlled substance schedule in India. Prosody, rate 100%, H1. Remember, pregabalin hidden behind H1 shelf. Valproate therapeutic trough range for seizure control, microscopic per milliliter. Speak, prosody rate 100%. Remember, keep valproate 50 to 100 happy. Phenytoin displays purple-brown discoloration called dot of skin. Hyperpigmentation. Remember, phenytoin paints skin purple patchy. Spake prosody rate 100%, AED that inhibits carbonic anhydrase and can cause metabolic acidosis, along with topiramate. Steak, prosody rate 100%, zonisamide. Remember, zonisamide zings pH acidic 2. Clobazam belongs to which benzodiazepine ring class, 1,4 or 1,5? Speak, 1,5 benzodiazepine. Remember, clobazam counts 1 to 5 on diazepine ring. First AED removed from market for teratogenic phocomelia in 1960s. Speak, prosody rate 100%, thalidomide, not used now. Remember, thalidomide, terrible teratogen reminder. Sabo brand name corresponds to which AED? Vigabatrin. Remember, Sabril seals GABA gate. AED that selectively blocks T-type calcium channels in thalamic neurons. Speak, prosody rate 100%, ethosuximide. Remember, ethosuximide tames thalamic tremor. AED contraindicated in porphyria as it induces ALA synthetase. Speak, prosody rate 100%, phenobarbital. Remember, barbiturate, bad for blood porphyrins. Diazepam gel, Diastat, should not be given more than times per month. Sive. Remember, 5 tubes monthly max to dodge drowsy. Withdrawal of which AED too rapidly may trigger rebound status epilepticus. Speak, benzodiazepines. Remember, benzo break leads to brainstorm. AED with risk of idiosyncratic liver failure needing monthly LFT monitoring first 6 months? Felbamate. Remember, felbamate forces frequent liver labs. Which AED is structurally related to tricyclic antidepressants and can worsen mood disorder? Carbamazepine. Remember, carbamazepine carries tricyclic temper baggage. Speak, prosody rate 100%. Valproate inhibits beta oxidation of fatty acids, leading to deficiency of cofactor. Carnitine. Remember, valproate steals carnitine fuel. AED that can cause reversible alopecia treatable with selenium and zinc? Valproate. Remember, valproate vacuuming hair, feed C and Zen. Phenobarbital induces CYP enzymes and accelerates vitamin D catabolism, causing blank. Speak, prosody rate 100% osteomalacia. Remember, phenobarbital prompts porous bones. Speak, a prosody rate equals 100% AED that blocks SB2A and is available as IV push over 5 minutes for status. Speak, levetiracetam. Remember, levetiracetam lightning IV option. Speak, prosody rate 100%. Zonisamide share sulfonamide structure, monitor for severe reaction, comma, specifically, find sulfonamide structure, monitor for severe reaction. Speak, prosody rate 100%, rash. Remember, sulfa skin rash risk with zonisamide. ADE that prolongs QT interval and must be avoided with macrolides. Speak, rufinamide shortens QT. Remember, rufinamide rapid QT shrink. Speak, prosody rate 100%, parampanel boxed warning for life-threatening behavior. Speak, prosody rate 100%, aggression, homicidal ideation. Remember, parampanel may push patient to punch. Speak, AED enhancing GABA irreversible inhibition of GABA transaminase. Vigabatrin. Remember, vigabatrin traps GABA forever. AED metabolized by esterases, not CYPs, used IV for status when phenytoin unavailable. Speak, valproate IV, prosody, rate 100%. Remember, valproate bypasses CYP, quick IV rescue. Topiramate can cause acute myopia and secondary closed angle. Glaucoma. Remember, topiramate turns eyes top-heavy. AED dosing must be doubled if patient starts rifampicin due to CYP induction, except for BA. Speak, prosody rate, lamotrigine, mainly glucuronidation. Remember, rifampicin airily rattles lamotrigine. Brivaracetam is scheduled under NDPS Act as Schedule Sent drug in India. Speak of H1. Remember, brivaracetam hides behind H1 tag. AED occasionally used for essential tremor besides seizures, mechanism NA channel block. Topiramate. Remember, topiramate tames tremor too. First-line prophylaxis for migraine that is also antiepileptic NA and CA blocker. Speak, prosody rate 100%, topiramate. Remember, topiramate tops migraine charts. Phenobarbital induces heme pathway, may worsen disease, porphyria. Acute intermittent. Acute intermittent. Remember, phenobarbital pours fuel on porphyria. Clobazam metabolic pathway via CYP3A4 to active, negative metabolite. Speak, prosody rate 100%, N-desmethylclobazam. Remember, clobazam spawns N-desmethyl mini-clone. Lacosamide is contraindicated with second/third degree block. Speak above 100 prosody, cursor, meaning, period. Remember, lacosamide slows AV avenue. First sign of valproate hepatotoxicity in children is rising serum. Ammonia. Remember, ammonia alarms in valproate kids. Speak theory that prolongs inactivated state of NEE channels and is structurally related to triazole antifungals. Refinamide. Remember, refinamide roughs up sodium with triazole twist. AEDs such as phenytoin accelerate metabolism of vitamin K-dependent clotting factors, causing neonatal hemorrhage. Remember, phenytoin pregnancy needs K to stop hemorrhage. Carbamazepine auto-induces its own metabolism, steady state reached after about weeks. Speak, prosody rate 100%, 3 to 4. Remember, carbamazepine teaches liver in 4 weeks. Speak, prosody rate 100%, clonazepam mechanism increases the of GABA A channel opening frequency. Speak, frequency. Remember, benzo buzzes channel faster. AED that can cause severe weight gain and polycystic ovary syndrome in adolescent girls. Speak, prosody rate 100%. Valproate, no. Speak. Remember, valproate packs pounds and pimples. First drug approved for focal seizures by potentiating KCNQ potassium currents. Speak, prosody rate 100%. Ezogabine, retigabine, N parentheses. Remember, ezogabine opens K gates, teal urine surprise. Retigabine withdrawn due to blue skin and retinol something. Pigmentation. Remember, retigabine paints people smurf. AED food interaction. High-fat meals double absorption of XXX sprinkle capsules. Cannabidiol. Remember, cannabidiol craves cheeseburger for uptake. Phenytoin acute IV toxicity produces hypotension due to parentheses solvent propylene glycol. Vehicle, and answer, not out prostate. Remember, propylene glycol pulls pressure down. AED causing severe depression and suicidal thoughts, reported post-marketing, especially in teens. Speak, prosody rate 100%, levetiracetam, comma. Remember, levetiracetam may lower life mood. Preferred AED for generalized tonic-clonic seizures during pregnancy when lamotrigine unavailable. Speak in prosody rate 100%, levetiracetam. Remember, levetiracetam least trouble for tummy tenant.